In this series, we're discussing the fundamental movement patterns from an integrative movement system perspective. The fundamental movement patterns from an integrative movement system perspective. So one of the things that we're discussing is how to set our clients up for success. There's lots of awesome patterns out there, lots of awesome exercises, infinite number of exercises. But one of the things we want to do to help our clients, especially those clients that are struggling with chronic tightness, discomfort, and or just can't perform at the levels they need to, or want to, or can't do the things that they love to do, is to help them master the basic fundamental movement patterns. Squatting, lunging, bending, rotation, which is our discussion from today. Ultimately, we'll talk about pushing and pulling patterns, as well as gait and or walking patterns, as well as carry patterns as well. So one of the things we'll discuss today is rotation and some of the things that we do to train rotation. But before we begin, just to look at a couple of the patterns that we use with our clients most frequently, let's just talk about rotation. Where should rotation happen and why is it important? Obviously, most activities of everyday life involve some rotation. When you're not just sitting there at your desk, you need to be rotating. You need rotation for walking. For example, you need the pelvis and lumbar spine to rotate towards the forward leg as you're walking, so that as I'm stepping this direction, I need my pelvis to be able to rotate towards that forward leg, create internal rotation. We need to create external rotation. We need our thorax, which when we're walking slowly, relatively moves in the same direction as the pelvis, but as we walk faster and or running, the thorax counter rotates to the lumbar spine, relatively to the lumbar spine and how the pelvis is moving. So we need that rotation. When we're when we're playing sports, we need that rotation. So say for example, I'm a right-handed thrower, I'm gonna step and I need the pelvis to rotate. I need the thorax to rotate. I need the entire spine to rotate. I need the head and neck to rotate. So we need spinal rotation regardless. If I'm bending forward to grab something off the floor and I'm using a contralateral, or I should say an asymmetrical lifting type strategy, I need to be able to rotate my spine, rotate my pelvis. My pelvis is rotating in the sagittal plane, but there needs to be a little bit of frontal plane and transverse plane rotation as well to grab something and come up. So again, activities of everyday life require rotation as well. Now, the challenge for many of our clients is rotation is, I should say, before we talk about our clients, rotation is one of the first movement patterns that we lose because generally speaking, we have a lot of rotation. Rotation is some of our largest ranges of motion collectively, and we tend to lose that rotation, and we start to limit, just say that we need this much rotation, we tend to limit our rotation because it creates, as we lose stability, we start to limit our range of motion within the bounds or the capacity of our body to stabilize, or our nervous system to stabilize. And that's why you see a lot of your older clients, when they walk with very rigid type strategies. They do more side bending than rotation. So one of the things that we can do to help our clients, especially our older clients, is help them improve their spinal rotation, so their thorax and the lumbar spine. And there's a lot of doctors that will tell their clients, don't rotate your spine. And for some clients, that may be appropriate or appropriate for a period of time. However, it's really also impractical for our clients and for everyday life and walking, as we discussed, because the less you rotate, the more likely you're going to lose balance and fall. So balance is a big part of balance is the ability to rotate. So hopefully I've sold you on rotation. And if you're a health and fitness professional, you already understand the importance of rotation. Now, how do we go about it? Number one, we want to assess our clients. We're going to look at hip rotation. We're going to look at lumbar spine and thoracic rotation. We're going to look at head and neck rotation. Obviously, we're looking at other things as well, but let's just focus on those few areas. So we're going to find where our client is restricted. We're going to do some myofascial release, some manual therapy, use whatever technique you use to release the areas of restriction so the client has the ability to actually rotate. Because again, if our client has myofascial tightness in one of their hips, it's going to be real hard to train that rotation. So again, doing some myofascial release will help prior to these patterns. Now, one of the patterns that I've demonstrated in the past that we like, so we'll start with the pelvis, is teaching our clients how to get pelvic rotation, pure pelvic rotation. So let me just turn you this way just a little bit here. Hope you're doing well today. Hope your week has started out well. Welcome again to our community. If you're part or new to our community, and if you're part of our community, welcome back. Thanks for being a part of our community and allowing us to be part of your community as well. Okay, so one of the patterns we love to do to improve the ability, the active ability of your client, or your client's active ability to rotate their pelvis and rotate their hip, is to put a yoga block next to a wall. Put their thigh next to that or against that yoga block. So now I'm going to create some isometric abduction of my thigh. Now my hands go on my pelvis, and I'm going to teach my client, train my client how to rotate their pelvis towards the forward leg and then away from the forward leg. So again, I've got the hip, knee, ankle, foot aligned. I've got my spine aligned. I'm rotating the entire thoraco-pelvic cylinder, so the rib cage, spine, and pelvis, rotating that around that lower extremity. Again, this will help so many clients that have hip osteoarthritis as well as spinal osteoarthritis, and really start to train your client how to use actively hip rotation versus just passively trying to stretch into it. So great pattern. This is where we begin with a lot of our clients. Now, what comes next? The next pattern we use with a lot of our clients, and we love this pattern because it trains both spinal rotation as well as hip rotation, is I like some bent over, some hip hinge with rotation. So if I have a table at my disposal, I will have the client put their leg up on the table and their other hand, forearm down on the table. From here, I'm going to cross this hand over. So my right leg is on the ground, my hip, knee, ankle, foot of this leg is aligned. I'm going to cross this arm over top of this shoulder. I'm going to breathe in, breathe out, and rotate towards the forward leg. So again, now I'm creating more spinal rotation relative to the pelvis and the lower extremity. I'm still getting some rotation in my lower extremity, so I can still feel a tremendous stretch here. So I'm moving the pelvis this direction, but I get a little bit more thoracic rotation, a little bit less pelvic and lumbar spine rotation. This is a great pattern to train thoracic rotation. And again, it's a rotation. Keep the head and face, the head, looking straight down towards the floor as you do your rotation. Now, what if your client doesn't have a bench, or that table isn't the right height for your client? We can still do this without the table. I'm going to do a hip hinge. I'm going to go in split stance. I'm going to put one hand down, put my forearm down. If I have a table like this or something, I can put the hand on, like a countertop or something like that. The other hand crosses over. I'm going to breathe in, breathe out, and rotate. So it's really the same exact pattern. So what's great about this is I'm teaching the individual to rotate their entire thoraco-pelvic cylinder. So I'm still getting a good stretch here in my posterior hip complex where most of your clients need it. And if you do that, like for example, before you do this, do a set of, or check your standing hip rotation. So check your standing hip rotation. So let me just do it real quick. Do this, check my rotation. Again, a little bit more limited on my left side. So let me do a setup on my left side. So again, I'm going to hinge, step back, cross my arm. And then I'm going to put my forearm down here so I stabilize my right side, and then rotate to my left side. So I'm going to breathe in, breathe out, and rotate. So I'll just do 10 repetitions, those 8. So it's a great way to start to move the pelvis independent of the femoral head. It's a great way to create rotation of the spine in a very controlled position. So we'll do a few more. You should feel a good stretch in the backside of the hip here. You should not feel any pressure in the back. If your client feels pressure in the back, they're probably coming too much into extension. So keep your client in a good hinge position, a good cylinder position, or good position of the rib cage over top of the pelvis. And now, if I stand back up, feet back together, check my right rotation. That was good before. Left rotation feels a lot freer. So very easy way to increase hip as well as spinal rotation. Very safe limits of rotation for your client. Now you can always add more load. So now let me turn you just a little bit this way. And again, when you're training rotation, it's the same idea, same concept. We want to think about using a light resistance. So most of our clients are using way too much rotation. So what happens is when they're training rotation, they're translating way off the vertical axis. So we want to think about a vertical axis. So when we're training rotation, I'm going to have my client breathe in, breathe out, and rotate. And think about rotating their trunk and spine on that vertical axis, coming through the top of the head, down through the spine. And again, in real life, that's not how the spine moves. However, to train effective rotation and rotation that your client learns how to control, this is the most effective way we have found. So again, it's grab the resistance. It's a light resistance. I'm bringing my right leg forward. Elbows are going to come up. We're going to breathe in, breathe out, and rotating away from the attachment, and then coming back, rotating back towards. And it's really a controlled rotation, long through the spine, and we're creating that axial rotation, that very long rotation. So it's no different here than what we did when we were here. It's the exact same rotation here as when we're standing up. It's the same exact rotation, obviously against resistance. So that way we're teaching the client how to really own that thoracic rotation, that spinal rotation, because again, we're talking thoracic rotation, but again, the lumbar spine is rotating just much less than the thoracic spine. So again, we've trained the ability to do hip rotation, we've trained the ability to do thorax rotation, and then we put some resistance on it so the client is learning how to move a resistance. So if they're bending down, grabbing their child and moving the load, if they're grabbing a bag of groceries and or laundry and turning and going to walk, we've taught them strategies of how to hinge, how to rotate around the hips, how to rotate around the spine, keep the rib cage over top the pelvis. So we've given them a strategy for everyday life so that they improve their alignment, they improve their control, and they improve their ability to rotate. And that's how you help your clients with thoracic rotation, and you become that go-to specialist for your current clients that can help them with a lot of clients with chronic low back issues, neck issues, knee issues related to poor overall spinal rotation. And you become that go-to specialist for your clients who need, want, and will pay you for your expertise.